The number of children dying before their 5th birthday has hit a record low, according to new United Nations estimates. And Malawi is among countries highlighted in a UN report released on Wednesday for making significant reductions in child deaths. It, alongside Cambodia, Rwanda and Mongolia, have all been credited with a more than 75% drop in under-5 mortality since 2000. In the Malawian town of Nemetete earlier this year, parents like Secret Gibson were queuing up to get their children vaccinated against malaria, under a new program being rolled out in countries across the continent.
When a child receives the vaccine like this, it means as he grows, he will be a healthy and strong person. But also, as he attains maturity, it's like you have already laid a good foundation for him. Because if you don't take him for the vaccine, the clinic has reservations to treat a child who did not take the jab.
Preventable and treatable causes such as pneumonia, diarrhea and malaria made up the majority of the 4.9 million under-5 deaths in 2022. While that's a halving of the mortality rate since 2000, it also still represents 1 death every 6 seconds. And the UN warned that the world is behind in its goals for reducing preventable deaths by 2030, with progress slowing since 2015. Overall, deaths of babies and children under 5 in 2022 were concentrated in sub-Saharan Africa. It represented 57% of the global total, despite only accounting for around 30% of the live births that year. The UN said better access to primary healthcare and community health workers could vastly improve the outlook. But it also warned that climate change, increasing inequity, conflict and the long-term fallout from the global health crisis could all threaten progress.